Next key barrier to recovery that I want to explore is an idea that I call secondary spikes. So I talked about this with Stuart on OCD Stories, so you might want to look up that episode on secondary spikes with Johnny Say. You'll probably find that easy enough. But to cover some of the basic ideas here, um, spike is the jargon for the sort of primary obsession, the OCD intrusive thoughts, the theme, which can take the form of worry, doubt, or judgment, can be made up of words, images, emotions, sensations, impulses, combination of these things. So the primary spike is, in many ways, you could think of it like the OCD theme or the specific way the theme shows up for the person. A secondary spike is when you're applying recovery skills on OCD and your mind gets sneaky and generates another bit of uncertainty or resistance to you applying the technique, which then hooks you back into either doing mental compulsions or physical compulsions or both. Um, and so this can show up when you are doing more traditional CBT and ERP, and you're doing response prevention. Many people I've worked with who've gone through ERP and were still struggling. Often they hadn't practiced and learned enough skills to help with mental compulsions. And then more specifically, they were experiencing secondary spikes that were then tripping them up and getting them back into rumination and analytical thinking and mental compulsions, and then often physical compulsions as well. And this shows up in ACT when we apply the ACT skills. So we apply diffusion, and our mind generates an uncertainty that tries to get us back into the mental compulsions or the difficulty that we're working on. It shows up I would say it shows up in all mental health challenges when you're working on recovery, in more generalized anxiety and panic, in depression and mood disorders, in psychosis. When I've worked with people in psychosis, it shows up there. Interpersonal difficulties, relationships, addictions, personality challenges, all kinds of things. When you work on the skills, different kind of resistance comes up from our thoughts and feelings, and then the skill is to recycle that resistance, to work our skills on the thoughts, the feelings, the urges that make up the resistance, and to apply our skills and keep going. The better we get at that, over time, it's like the mind sort of settles and generates less secondary spikes and less resistance. But our minds are very frightened of change here. Our mind is scared of dropping these safety behaviors and compulsions that it feels are protecting us. So it wants to keep that going. There's also theories around the sort of dopamine addiction path of compulsions as well, where we are getting some level of dopamine from completing the rituals in the right way or trying to figure stuff out in our mental compulsions. And like any drug, when you withdraw that, the mind and body resist that and tries to get us back into the addiction. So I think in a way it's resistance coming from an anxiety and threat based part of our brain, and then also from the reinforcement and addictive process of doing the compulsions, which at some point gave us some reassurance and ease, or not true ease, but they kind of scratched the itch for a moment, even though over time they were inflaming it. But it's quite addictive to scratch an itch. It feels like it's helping, even though it's inflaming it. So I think this is why our mind does. It's not that our mind is really against us. These are all mechanisms from evolution and our history that are trying to help us survive, but a little bit like a autoimmune disease. Our immune system is really helpful, but it can turn back on itself. These processes can be helpful when they get us to avoid, genuine threats to our ancestors, or genuine social threats within a tribe where if you got thrown out of it, you were going to be in trouble. But now in our modern context, they become a bit more like autoimmune diseases, turn back on themselves, and even more so in OCD, where the threat system is really overactive, or the uncertainty solving part of our brain is getting really amplified to a point where it just devastates our life and pulls us out of what matters to us. So we really want to recycle this resistance, apply the technique. The secondary spike comes up, the resistance comes up, recycle it with our skills, and then refocus on our value directions. And like a metaphor I like from Reed Wilson is, you score a point every time you do this, every time you step back and then you re-engage in a valued task or direction, you're scoring points. And we want to score lots and lots of points, and even more points when we're getting secondary spikes. So I'll list a few. This is not an exhaustive list, and we can certainly go into stuff in more detail down the line. But one thing is, the obsession just switches form. So it goes from verbal thoughts to images, or from images to more, it gets kind of crunched into an emotional feeling that we just know is related to the OCD, or it turns into an impulse or body sensation. So it changes its form. It could change its intensity, so it could become more intense, like the images get more graphic and more frightening or disturbing or distressing. The actual wording can change from a kind of what if uncertainty to more of a judgment statement. You are this terrible thing, or this terrible thing's going to happen, or a command, you should do this, or this is going to happen. So it changes its sort of intensity of its wording to get you to do the compulsion, or the images, or the feeling. It can kind of sound more like an inner critic than an anxious OCD voice. Sometimes I find they can merge together for clients, or it can switch form there. It will switch around emotions. So for a long time, we've had, anxiety and very, typical anxiety as the main emotion. Then it switches more to disgust or doubt and confusion. We go kind of numb, but we feel this doubtful, confused feeling, or guilt and shame get strong, or numbness, or depressive sort of feelings, or anger, frustration. And then this gets us ruminating. It's a secondary spike in that it pulls us into analyzing our feelings. What does it mean? I'm not frightened of this anymore, so maybe I want to do this thing, or maybe this thing's more likely to happen. Or as Stephen Phillipson has called it, the backdoor spike is related to this. So the feeling switches or disappears because we're starting to tolerate the uncertainty, and then OCD starts to ruminate, why aren't you feeling anxious anymore? This must be likely to happen, and then we're back into the mental compulsions. So really it's, the feelings are generating more analysis over feelings. Why do I not feel anything? Or why do I feel this? Or confusion and doubt and uncertainty about feelings. It can hop themes, so it can move from, you've been struggling with, sexual orientation OCD, and then it switches to relationship OCD, or you've been experiencing contamination based OCD with, fears about yourself, and it switches to moral scrupulosity about others, or you go from, harm OCD, and then it switches to existential. You go from checking OCD, and then it switches to health anxiety, health OCD. So it can just switch around like the main topics. Doesn't do this for everyone, but for a lot of people it can hop around topics, pulling you back in. Or it can blend. Sometimes you experience existential OCD and your mind tells you, cuss, you think nothing matters, you're going to suddenly hurt people, or it sort of blends themes together like that. Or sexual orientation, sexual OCD themes with relationship OCD, or different ways it sort of blends together. You can get a strong spike, secondary spike, about, am I doing the technique right? Is it working? What's the right way to respond here? Should I use this mode of therapy, that mode of therapy? So it can really get you into analyzing the technique. Are you doing it right? Are you doing exposure right? This real fear of, if I don't do it right, I'm going to be in trouble. Perfectionism can get in there. Will it work? Will it not work? Recovery fears, doubting the mechanism and how you do diffusion or response prevention, letting go of mental compulsions, or focusing and engaging in life. Is it distraction or is it not? And your mind will just find the uncertainty in the technique and get you analyzing about that. So that's a very common secondary spike. And it can relate to hopelessness, and it's not working, and you're judging, is it working or not? And of course that keeps all the focus on the threat and the difficulty. And lots of ways that could show up. Uh, Fears around, if I do the exposure, is it going to make me more likely to be the feared consequence of the OCD, the thing I'm worried happening? Will it happen because of doing exposure and this kind of thing? And it all pulls us back into our head and then back into avoidance. A common one that happens a lot, and I think Jonathan Grayson was one of the first people to identify this, is that it can switch from a core fear around the threat and danger and hurting ourselves or others or harm coming to bear. And then it can switch to unhappiness, the fear that because of the OCD, we're not going to enjoy our life, we're going to be distracted forever, sort of stuck thought, or hyper awareness, somatosensory sort of stuff. We're feeling like this OCD experience is going to be there, these intrusive thoughts are going to be there all the time, and we can't enjoy our life. And then we start ruminating more about the happiness. So it goes from a core fear of, what if I hurt someone, to what if I have these intrusive thoughts about harm for the rest of my life, and they just distract me and I can't enjoy, and they ruin these important experiences for me? Or I have this feeling or this body sensation forever, things like that. Really common one is, this is an OCD, or what if this is an OCD? And that shows up in lots of ways. It can pull in our history and sort of false memory, real events. It can, pull in something totally unrelated that we enjoy or like doing, or part of our learning history, or something we've regretted or felt confused about, and it can blend it in and trick us into thinking there's something unique about our OCD that means it is an OCD. There's something that happened in our history that means that this is a real thing to consider. So it'll always do that. Everyone has something in their life that's either, some part of their learning experience, an experience they had that was traumatic or frightening or dangerous, or something they regret that is not anywhere near as problematic as their mind is saying it is, but it's enough to get us going. Well, what if this isn't OCD, and this is really something else? So we've got to do that courageous thing of diffusing that and recycling that resistance and working with it as a doubt that doesn't need to be solved, that isn't helpful to solve it, and will only ruin our life and pull us out of our life by trying to solve it, and hurt other people from the sense that it will pull us away and make it hard for us to connect and be the person we want to be. It can pull in a secondary spike of resentment. We start feeling frustrated and resenting and sort of hating on the OCD. And that can reassure us sometimes that, oh, I really don't like this, so it can't be true. Or it's just another way our mind gets into analyzing. And related to this, it can interact with depression and depressive thought loops or feelings, hopelessness, helplessness, self-criticism, judgment, feelings of guilt and shame and regret. And it can pull us into that and pull us back into this difficulty that keeps us stuck and stops us moving forward, and can rob our motivation to practice, and can be a way that OCD blocks us when we're not listening to the anxiety anymore. It throws up this depressive feeling or thought to get us to avoid and to do the compulsions. It can interact with thoughts and feelings and sensations, everything can bounce off each other, and we can have, strong body sensations that come up as secondary spikes, things like the feeling of contamination and disgust. We feel like we got something on us, or, the unwanted, sexual arousal, the groinal, it's often called, these feelings that we're, having arousal when really we're very frightened, confused, distressed. And, we're just scanning and checking our body, and nerves are firing. Imagined impulses, the feeling like we're going to do something, we're going to stand by the edge of the platform and jump off, that kind of feeling of an impulse. Sensory motor stuff, we get locked on neutral body sensations, or health anxiety type symptoms like aversive, difficult things, the breath, nausea, bowel, bladder sensations, things like that. Pressure, pain, strange perceptual things, disorientation, confusion, blank mind, depersonalization, detached daydreaming, dissociative stuff. We can have all of that can happen as you start to, resist compulsions. For some people, if they have that in their history, sometimes, for me, I would get a lot of depersonalization type stuff would come up as I, tried to reduce the compulsions and focus on life. So, and panic attacks, an increase in emotion that pulls us back into it, and, and weird perceptual, strange sensations at head, or, feelings of balance or dizziness, or the many ways anxiety can show up in our nervous system, and doubt and other emotions as well. We can be pulled back into, reasons why, our mind will give us reason giving why this isn't just OCD and we need to work on it, or why this is a genuine threat, and why we should distrust our sense of self. So reason giving is a thought category, an act which often blocks behavior change. So we've got to look out for the reasons our mind gives us to keep going, and diffuse them, realize why they're unworkable and not helpful, and instead focus on values and important, meaningful goals. That's just some of the ways this shows up. So what do we want to do in response? As I said at the beginning, really we're working this principle called recycle the resistance. So you diffuse the thoughts that come up to block you, or you accept the feelings that come up to block you. So using the skills from this channel to work on that resistance, and to not get tricked back into ruminating and doing physical compulsions. Instead, urge surf that, and diffuse and step back and let go of the mental compulsions, and engage in the things that matter to you, and doing that relentlessly, scoring those points over and over again. We want to use this as a pain alarm clock to remind us to come back to these skills, and to our values, and the things that really matter to us. And remember, values aren't necessarily big, dramatic. They're not always egalitarian, other focused things. They can be just, simple joys, pleasures, fun things you enjoy, things that you have to do to run your life well, that are more proactive. It doesn't always have to be dramatic, purposeful things. It can be small purpose or big purpose, but you know why you're doing it, and it's important. And more traditional CBT, you continue with the exposure, you try to work the response prevention, but you might want to add in things like ACT or metacognitive therapy, or rumination focused ERP ideas, something to help you with those mental compulsions if you're struggling with that, and talking to your therapist about how to work on the mental compulsions would be really useful. And then ultimately want to be able to allow this stuff to come and go without doing the mental compulsions, and engage and really focus in what we're doing, allow and engage. And the engaging part is important, because you could say, okay, if I just drop the compulsions, is that enough? But really, a lot of research particularly a study by Dan Gilbert at Harvard about a wandering mind being an unhappy mind, showed that most people's minds are wandering 50 to 60% of the time away from what they're doing. And more often than not, it predicts negative rumination, and not, our mind isn't going to nice places a lot of the time. It's ruminating about groups and thinking about mistakes and things we've done socially wrong, or our to-do list, our worries, things we have to do. So to be able to actually diffuse that stuff as well and engage and practice our engagement and focusing skills, I think is really useful. And everyone in life knows that focus is important. Like, ask any athlete, any person that works in high pressure environment, they're going to value focusing skills and looking at ways to enhance that. And that's why people like the Marines and athletes are using mindfulness and other practices to work on their ability to focus on the things that matter. So with OCD, this isn't distraction. We're not doing this to push away stuff. We're doing it because we value it. And as Mark Freeman says, the rumination is the distraction. That's the thing that pulls you away from the things that matter. So we're not pushing it away. We're allowing it to be there. The automatic stuff to be there, the obsessions and the difficult feelings that are automatic, but we're engaging, in what matters without doing our compulsions. And that's really the key. You can set your intention for this. You can, at the start of the day, set your intention to work your skills and to work on, secondary loops, secondary spikes, and how they'll resist this. And really doing this practice with gentle relentlessness, seeing this as a pain alarm clock that reminds you to work these skills and run through it over and over. And if we get good at this, there are even secondary benefits. We're going to be more present in our life, more connected to the people that matter, better able to handle pain, suffering, other difficulties that are non-OCD related, and less taking our minds seriously, and able to choose whether our emotions are important and should influence us, or whether they're the noise of a Pleistocene nervous system that really isn't adapted to the world we live in. And even in the Pleistocene epoch was about survival, not about happiness. So our feelings can be helpful and useful information, but a lot of the time they're not. And being able to choose to how we respond to thoughts and feelings is really, the key message from ACT. So yeah, hopefully some ideas on secondary spikes. Feel free to post any questions below and practice it. Work on this with your therapist if you're in therapy. Talk about these secondary spikes, how to respond to them, and be relentless in your practice.